RDMD is a rare disease research company, and we work directly with patients in order to accelerate treatments and drug developments for their disease. I had a rare disease diagnosis 4 years ago myself after developing tumors in my central nervous system, and I went on a journey to figure out what I could do. So obviously, as a patient, I wanted to do something about it. And one of the things I found is that there is a lack of resources in all rare diseases, and I think we can build them with the patient's help. So we empower the patients to be part of the drug development process instead of just being a bystander. So a lot of the resources for drug development are related to your data, your medical records, genomic data that is available, your samples, and they are usually trapped in institutions and in hospitals, and especially for rare diseases. There can be 40 or 50 different centers that have a bunch of patients, so it is almost impossible to get that all out and bring it together. So what we do is we go direct to patients and we help them get their entire record out of all the hospitals they ever been to, and then we structure the data and create the identified data sets that can be used for research. So usually as a patient you have the right to this information, it's yours, but it is incredibly hard to get it out and then to build a quality data set with many patients out of it. So the way this usually happens is after a pharma company started, they're going to all the hospitals to build these resources, which can take years and lots of money to get it. So what I want to do is kind of give the patients the opportunity to do it. So they are the ones owning their data, they're the ones holding their consent, and our organization is accountable to them. So we really sort of need to listen really well, even as a company, to what the patients want and work with them, because we are building a trust relationship with the patients. As a bonus, when we have all the information from the patient and we have structured everything, we give them an app which we call a locker, and they can access all their information there. So for example, that includes MRI scans, but also all the records and tests that are relevant for their particular rare disease. So we tailor the product to the needs of the rare disease, and patients have been using that to, for example, share it with a new doctor or get a remote second opinion from them, something that is usually very hard to do, because every time you want to call a new doctor, they would have to do all that work over and over again. So it gives you, it sort of empowers you because now you have that information all accessible. And to me, the best part of being a fan of this company and is working with the people that join our company. Everybody is really mission driven, working with the patients directly, working with the foundations, the doctors, and the industry partners. And I feel we can be the glue sort of between all these different organizations and hopefully help the industry to kind of collaborate more effectively. There are so many rare diseases. There are 7,000 rare diseases. 95% don't have an approved therapy on the market. And even if you have a disease that has a therapy on the market, those are usually not optimal either. So there is a real big need to make it more easy and more accessible to enter that industry and sort of develop these treatments for these groups. I also think it's in rare disease, you have to think differently, you have to be creative and find new ways of collaborating and working together. Otherwise, you will just not make it. You will not really be effective in bringing new solutions. So it is also sort of a starting point maybe of something bigger. Like you can experiment, you have to experiment in these rare disease areas and sort of really work with what you got, which could lead maybe to something bigger later on. So I'm really curious and inspired to see where it goes.